So basically testing begins for prostate cancer with your PSA and your digital rectal exam. I'm going to walk you through about the PSA, the digital rectal exam, and then ultimately if the PSA or the digital rectal exam is abnormal, we would consider a prostate biopsy. So let's talk about PSA. It's a very controversial issue. It's in the press a lot, but it's basically a blood test and it measures prostate-specific antigen. There's no specific number that defines abnormal PSA, but the higher the PSA, the higher the likelihood you have prostate cancer. The number that we use at MIU as abnormal is 2.5, but we don't look at it at one point in time. We look at the man's PSA throughout his life, and is it increasing, is it shooting up? Those can be indications that prostate cancer may be present. So that is why we try to establish a benchmark or an early PSA in guys around that 50-year-old time point, sometimes a little bit earlier if the guy has a family history of prostate cancer. If the guy is African American, we'd want to check that PSA sometimes a little earlier. The guidelines with PSA are changing rapidly, but I think the key that we can never forget is that PSA saves lives, okay? It saves lives in every study we've looked at, and we have to use it, but also have to refine it with some new technology, and I'll talk a little bit about the new technologies that are helping PSA be a better test. So one of the confusing things and one of the frustrating things about PSA is that even if it's high, it usually doesn't mean you have prostate cancer. PSA is a non-specific test. It can be elevated usually for other reasons. It's a better measure for prostate health. So sometimes guys will walk in, their PSA is high. I could try to talk them down and say, you know what, it's probably not cancer. It's probably related to an enlarged prostate, which is a normal part of male aging. It could be related to inflammation or irritation or a prostatitis, or it could be simply related to recent ejaculation. It could be related to any manipulation of the prostate through a digital rectal exam, or it can even be affected by if a guy's riding a bicycle a lot. You know, those can cause false elevations, and that's the challenge and the frustrating part about PSA is that the PSA, an elevated PSA, does not always mean cancer, and it usually doesn't.